Empowering you into action. This is Warriors Talk with your host, Lady Rochelle.
Hello. Welcome to Warriors Talk with your host, Lady Rochelle, where we move away from awareness towards action. Tonight's conversation is one that hits home for so many, but it's often left unspoken. Our topic: mental health matters, breaking the silence. Mental health is just as important as physical health, but the stigma, the fear, and the misinformation often keeps us quiet. Well, not tonight. We're here to talk about it, normalize it, and encourage healing. We're live on Intellectual Radio, and we just heard from The Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, Rizal and I talked about, are men still providers, redefining gender roles in modern relationships. You can head on over to YouTube and type in Intellectual Radio and stay connected for any episodes you may have missed. The quote of the day is, "It doesn't matter how slowly you go, as long as you don't stop." We have two announcements on today. Our first announcement is regarding former President Joe Biden, who was diagnosed on Friday with an aggressive form of prostate cancer that has spread to his bones, according to a statement from his office. The diagnosis came after Biden reportedly was complaining about urinary symptoms, which led the doctor to find a small nodule on his prostate. Biden's cancer is characterized by a Gleason score of 9, which metastasized to the bones, and the Gleason score is used to describe how the prostate cancer looks under the microscope. A 9 and a 10 are the most aggressive. While this represents the more aggressive form of the disease, the cancer appears to be hormone sensitive, which allows for effective management, according to a statement from his office. The former president and his family are reviewing treatment options with his physician. So please keep former President Biden and his family in your prayers. Warriors Talk will be having our 9th annual Survivor Celebration of Reflection Gala taking place on Saturday, October the 18th, 12 p.m. to 4 p.m. at the Crystal Sky Banquets. Tickets will go on sale soon, so make sure you save the date as we continue to celebrate and meet the needs of the warriors in battle. And if you are tuned in on any form of social media, please like the show, share the show, and invite someone else in on the show that you feel may benefit from this valuable information. I'm so grateful for my sponsor on today. We have Pastor Michael Richardson with the Emmanuel Church of God in Christ, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emmanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emmanuel Kojic at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emmanuel Kojic-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we're from the Emmanuel Church of God in Christ. We are building upon a solid foundation.
My special guest today is our Healthy Solution expert with over 20 years experience as a family physician, impacting lives every single day, as an advocate for total wellness, including mental health. Welcome back to the show, Dr. Michelle Meeks. Hey, Doc.
Hello.
How-
Hi. How are you today?
I'm good. How are you?
Good, good. Happy Monday. Start of a
Yeah,
new week.
I know. Excited about Mondays.
You're right. You have to be, right? You got to look forward to what's coming.
Yes, absolutely. I'm excited about the topic on today. I know that many people will be helped, blessed, and moved to take action on today after listening to the show.
Yes. Yes. This is an important topic that no one talks about, but everyone experiences on a personal or friend or something level, but we just don't really talk about it enough.
Absolutely. Our topic again is mental health matters, breaking the silence. So I just want to jump right into the conversation, Doc, and just ask, what is mental health and why is it important to our overall well-being?
Yes. So mental health is really about your emotional health, how well you feel, how happy, satisfied you are day to day with your life, with your experiences, right? And the mental health that you feel starts with the organ, your brain. And your brain is like any other organ, like your heart, your kidneys, it sometimes will function very well for us, and sometimes it needs extra care to help us feel good. And so, mental health, it matters because it affects a lot of things. When you feel bad, it can affect your physical, right? It affects your relationships with family and friends. It can affect your job and how well you're able to function and cognitively do the things you need to do. And so our mental health really matters as much as our physical health. And we need to put as much care into that as we do our physical health, if not more.
I totally agree with you on that. When I was going through my cancer journey, I just remember not being offered anything as it related to mental. And I feel like that should be part of the prescription as well as you're going through the physical part, the mental part, you should be going simultaneously going through that as well, especially with such a life altering diagnosis such as cancer.
Yes,
So I
yes.
agree with you on that statement.
Absolutely, right? Because when you're going through a chronic illness or something as devastating as cancer, we know that how much that affects your physical, but it also affects your emotional. And I will talk to, nurses and colleagues and, folks in the medical field all the time about it's so hard as a physician to manage your physical health if your mental health is not good in a good place, right? Because you can't do the things that we would want you to do to take care of yourself, your body, fight whatever disease you need to fight, right? And so when I'm talking and educating nurses, I'm always, talking about, well, as much as we know we have things we need to do for that patient, did we ask about their mental health, right? Did we assess how they're feeling today, right? What are the struggles that they may be going through? Because everyone is going through struggles on a different level.
That is true. That's so true. How often did you see patients presenting physical symptoms that were actually linked to mental health issues like anxiety or depression?
Yes. Well, I'll tell you, I'm not an ER physician, but I know my ER colleagues can really speak to this, right? Because people will present in the emergency room. And I think I was reading something that, especially for Black Americans, because our mental health is even more bombarded, and we may have barriers to access to care, that we tend to use the emergency room as the primary visit, or we have symptoms that like anxiety, chest pain, even acid reflux, right? We worry, we create ulcers. We know that those things can start from worry and mental health concerns, and you will present with a physical symptom, but really the root of it is emotional, is, and not to say that you're not having physical, right? But let's deal with both things. Let's give you what we need to help you feel better physically, but hey, what's going on emotionally? And that's why as providers, even in the ER and even as a primary care doctor, we always are trying to assess how someone is feeling really on every visit, not on your annual checkup, right? We go a little deeper into those type of um, mental health assessment screening questions. And think about it, when you go to your doctor, they're like, "Oh, how are you today?" Right? And you are thinking, well, let me tell them if my chest pain's better, or if I'm short of breath, or if I'm having diarrhea, whatever. But some of that we as providers even have to do better at saying, um, how are you feeling emotionally today? Are you under any increased stress, over the last week? How do you think that's affecting your physical health? And doing a better job at asking those questions so that for the patient, it's just as normal as when we ask you, are you having chest pain today? Right? It should be the same sort of, it should be given the same weight.
Totally agree with that. Yes, absolutely. Why do you think, Doc, that it's so hard for people, especially in the community of color, to talk about mental health?
Yeah, well, we know that there's a stigma, and especially in the Black community, sometimes we see it as some sort of personal weakness, right? And that we should just work through it, get through it, just change how you're thinking. You're not strong enough. And so then we start to feel like, well, what's wrong? If I can't feel better, I can't, will myself out of my depression or anxiety, I'm not strong or weak, or I'm weak. And that can happen sometimes in our faith communities, right? That's a difficult um conversation sometimes to have, because we use our faith as a sense of strength, community. It can help us not feel so isolated, right? And that's really important, to seek that, and for the faith community to be open to supporting them, right? Because we can use prayer and we can use all those things to help us get through, but you may also need, with that, right, to talk to someone, and sometimes our faith community and our pastors and healers are really good at talking with us about how to look at something differently, how you can move through this trial to get to the triumph of feeling better. And then sometimes you feel, if you don't feel comfortable talking to your church community, that's where mental health counselors and psychiatrists can come in. And sometimes you need, depending on your mental health, or if you have a serious mental illness, we call that SMI in the medical community, right? If you have a serious mental illness, like bipolar, like schizophrenia, right? That's great to have that faith community as a support, but you also are going to need medication to stabilize your symptoms. So they work hand in hand.
I think that was my next question is, as a woman of faith and a physician, how do you speak to the balance between faith and the profession of like mental health care?
Yes. And I remember having a conversation with a patient way back who she had really high blood pressure. It's kind of a little bit different and similar. She had really bad high blood pressure. I mean, her top number was 200. She had the kidney. We could see that it was affecting her kidneys and all of that. And I would try to talk to her about medication, and she was staunch on, my God is going to see me through, and I don't need medication. And I said, that is great, because I lean on faith too. And I had conversations with her about that. And I also um, talk to patients and say, I want you to lean on your faith. But guess what? My God also gave me the knowledge and the tools and blessed me with what I can do from a medical standpoint to help you through it. And it doesn't have to be one or the other. She never did take medications from me. She never did. And she actually, until I think I left that practice, was doing okay. She was within her right mind. God was working with her that she never had a stroke. And I would see her and her blood pressure would be systolic, the top number of 200. And I couldn't argue with her, right? I'm like, well, you're doing okay. But, everything in me from a medical doctor perspective said, no, we need to lower your blood pressure because you're at increase for stroke, heart attacks, and all the horrible things that can happen. But I have to have an open conversation with folks, right? I say, I don't want you to not turn to your faith for support, but I also want you to use the tools that we do have, right? And use your faith to help you through some of the lifestyle things that we always talk about, right? Sometimes you need that to sort of help you when you need to exercise and motivation, and when you want to meditate and pray, because we know that that lowers blood pressure and stress and can help us, right? Through those trial and tribulations that we go through, right? Because when we are going through something, what do we turn to first, right? We turn to prayer, we turn to God, because it's soothing, it gives us comfort, and all of those things help us not only on the medical side, but the mental side.
Yes, this is one of the things I had to really rely on when I was going through my cancer journey was my faith. And even with this walk through getting my blood pressure in check, right? I just met right now Darius Brooks, and I was telling him that one of his songs, Your Will, actually got me through my cancer journey. Like, I was playing that song every single day, just nurturing myself with the song. But at the same time, I was doing what I was supposed to do for me.
Right.
So I was taking action. And I prayed and I said, okay, God, like, you gave me this body. You know how this body operates. You know how it should operate. So, you know, teach me, show me, give me the resources on what to do, how to do, so that it can function as it should, so that I can walk in purpose, so that I can do your will. And Dr. Michelle, I have been working on this blood pressure. And when I started, I told you I went to the doctor. It was like 169 over what,
Mm.
something like that. I took it Saturday, Dr. Michelle. It was 117 over 60.
Mm.
And
Ooh,
my heart rate
what?
was 85. I was like, look
What?
at God. I
Look at God.
So I was really
Yes.
excited about that. And this is what, 3 months out. So now it's time for me to make my appointment to follow up with my doctor to say, hey, here is my log. This is what I've been doing. And yeah, I could allow this to affect me mentally and be depressed about it and just give up and not think that I could do anything. But it's because of my faith that
Yes.
I'm pushing through, because I know God has me, but I also know
Yes.
faith without works is dead, and that I have
Right.
to do something for
Yes.
myself, and God is going to meet me, not just, you know, when I'm up, but he's going to meet me when I'm down and say, okay, I got you. You know, I'm
Right.
right with you. The
Yes.
footsteps that you see, that's not yours. That's me. I'm carrying you.
Right.
But
Yes.
you have to do what you need to do for yourself as well.
Right. Yes. He gave us that ability, that higher functioning brain and ability to be able to say, yes, I depend on you, Lord, but you also gave me these tools, this brain, this beautiful body to do these other, to make these decisions, right? To do the right thing, to walk with you. And so and that's the thing, you have to have a good balance, right? When we're talking about mental health, because you said, I think one of your the things that you said was that people just think they can just pray out of depression and anxiety, right? And we know that depending on what is causing you depression and anxiety, where the root of that is, I'm always saying that we're going to turn to the word and God and our faith and whatever that is that gives you strength when you're down, for sure, right? Because that's how we are able to move to action, right? When you sort of pray about that and ask for that help in those quiet moments. And even with that, right, there are some people that can definitely um, just use prayer alone and their faith community and their support, depending on what it is that is bringing you down. But we also know that there's serious mental illness that is related to chemical imbalances in the brain, right? And I would tell patients, when I had someone like that, I say it's just like diabetes, there's an imbalance of the sugar in your body. With serious mental illness like a bipolar, like a schizophrenia, there is an imbalance in the dopamine, serotonin, and other chemicals in your body that we have to bring to balance. And we can do both of those things, because the first thing is we want you to feel better as quickly as we can, especially if someone is to the point where they're having suicidal thoughts and they finally come and actually are talking to someone about it. We have to take action on that, right? Um, but in that, the issue and the thing really is decreasing the stigma and talking about it and feeling like you can talk and open to your pastor, your friends, your family, that it's not a personal weakness for you. But so that's one of the first things we have to do is talk about it, which we're doing now.
Yes, creating a safe space for people to want to be open and not feel judged and not
Yeah,
looked at like there's something wrong with them because they do want to go and seek help, um,
yeah,
be supportive.
yeah. And sometimes if you know someone, if you're a family or a friend and you're seeing something in someone else, right? You don't want to say, girl, what's wrong with you? You want to come from a sense of, hey, you seem really down today. There are times where a patient would walk in my room and I am like, something's not right. They might they might come at me with an attitude, or they might come with me really just kind of flat. And I'll just ask that question. I'll say, hey, you seem really sad or down today. What's going on? How can I help? Or if it's the other side, I'm like, you seem very angry today, because that is starting the conversation. And so you can do that with people in your own orb, right? It's just asking the question in a non-judgmental way that you want to help someone.
Yes. I remember having my last daughter and my doctor. I was really close with her. So she knew when I came in there because she knew all about the pregnancy and everything that happened. And so I came in one day and she was like, "Are you okay? Like, you seem kind of, out of it or whatever." And she took out her sheet and started asking me the questions
Yeah.
about mental health. And then she was like, "I want to prescribe you with something, like if you're open to it." And I told her I wasn't open to taking anything, but I did recognize that I was, you know, feeling a certain way. I didn't know, Dr. Michelle, how depressed I was. I was crying every day for like 3 months nonstop.
Mm,
I would drop the kids off at school and I would come home and lie in the bed with my baby and I would just cry. And then I
mm,
realized, you're crying next to this baby. This baby,
mm.
you're
Feels it.
like,
Yes.
this is not a good thing. And if it wasn't for like my church and just, and my kids and saying, okay, you gotta snap out of this and you gotta really, get a hold of it, I probably would have slipped into a deeper depression. And so my question is, and we talk about this all the time around the holidays, Dr. Michelle, when we talk about sad, like the difference between being sad and clinically depressed.
Right. So, if you're talking about, we talk about SAD around the holidays, and we also talk about SAD, SAD, seasonal affective disorder, right? Which is more of a sort of temporary feeling of sadness that can come sometimes around the holidays. We also call it holiday blues, or when the days are really short and it really does affect our circadian rhythm and how we feel during the day, because we know that actually sunshine and vitamin D can make us feel better. But if you are feeling down, and we talk about 3 months is kind of this threshold, right? If your symptoms have been going on longer than 3 months, we're into the 6 month, and you're just still crying, still sad, can't pull yourself out of it and have good days. That is more sort of clinical depression. And we also will do certain questions that we will ask, right, about um, do you find yourself not wanting to do things that used to bring you joy before? Maybe you always, I don't know, maybe you knitted, maybe you knit or you go roller skating, and now you just don't feel like doing that at all, right? Do you think that how many days out of the week do you wake up just feeling sad? Even before you get out of bed, you feel sad and blue, right? So we do have certain questions that we will ask. And sometimes that sadness can be related if you're feeling down related to a certain event, right? Someone passed away, or you're not feeling good, or there's some event that has happened that makes you feel down. But again, if those symptoms are lingering and you're past 3 months, you're getting into 6 months and you're still feeling down and blue, and we're asked, and then we should be asking certain questions. But for the layperson, if you're feeling down and it's been, since, I don't know, Christmas that you've been down, that's not just holiday blues, right? That's not just seasonal affective disorder because we're into month 5. That's something we need to address. And you can talk to your primary care provider. Some people think, well, I have to go and see a psychiatrist or a mental health counselor right off the bat. Your primary care provider can do that screening, and talk to you about what the resources are that may be available to you. Sometimes your insurance has telehealth, behavioral health options where you can talk to someone without having to go into an office, which is very convenient for a lot of people who don't want to go into an office, or be seen going into an office or something like that.
Wow. I want to say the silence that we sit in when it comes to mental health can be deadly.
Yes. Yeah, because sometimes if you're suffering in silence, we talk about, and we hear of someone who committed suicide. I know in some of my doctor groups on Facebook, I'll get these, things that come over to say that someone, committed suicide. And that person was suffering and feeling a certain way in silence because of a stigma, and didn't want to talk about it, right? And we don't want that to happen. And every time it happens, we have these conversations about, we have to talk about it in the open, right? We have to ask people how they're feeling, especially if you know they're going through something, because they may not bring it up. Even as a provider, no patient comes to me, right, and says, doc, I'm feeling real anxious. They're they're not, and I'm the doctor. They should be telling me, right? But they're not going to do it. They may say something more of a physical symptom, right? I'm just not sleeping at night. I just, not eating very well. Sometimes I get, a lot of heartburn. It's always the physical because they feel easier talking about that. And that's why we have to be proactive with our actions. As you talk about moving from awareness to action, is what do we do with the information that we're talking about today, right? If you know of someone, or if you have family members or friends that somewhere in the past that they had anxiety or depression, give them a call, give them a text. Hey, I'm just checking on you, because you never know when that person needs to hear those words from you, right? I just wanted to check on you. I want to see how you were doing today. You were on my mind. I always tell myself, if someone's on my mind more than once in a day, I probably need to reach out to them. There's a reason they're on your mind. So we have to be proactive in how we support our folks that are around us as well. And think about, we haven't even talked about the teenagers and access to social media and what that does, especially for young girls who see that. And we know that there's more depression that we're seeing in our teenagers and young adults and even tweens, that are always on social media. And for parents, we have to be active and look at your kids and see how they're acting, and are they happy, and are they doing the same things that they do normally, are their friends the same friends, and all of that, right? So that we can be proactive in trying to find anything that we can find out, especially with our kids, because they're not going to talk. Teenagers are quite silent some days, so.
That's true. At church Sunday, one of our members informed us that her son friend, who was 27, graduated a couple years ago, committed suicide week. And I was just like, oh my goodness. Like at that age, you would think, you know, the world is at your feet. Like there's so much that, you know, you can do. The sky is the limit. And you just don't know what people may be struggling with.
Yeah, and a lot of we know the first mental health real issue episode, if someone has depression, anxiety, occurs in the teens to early 20s, right? So those are the times where we need to be even more like asking and aware as friends and parents, because the first mental health occurrence that is significant occurs in the teenager and 20s, right? And we think, okay, we can see teens because their emotions and the hormones and all of that are happening, but not only that, in their 20s. So why is that? I'm not exactly sure why, even in the 20s, but they're coming into a lot of responsibilities as well, right? The brain is maturing. That's when, there's a lot of things going on with the brain as it matures, because we know that the brain matures much later in our lives, for in our 20s and 30s. So we have to be aware of those things, and people can put up a good face sometimes. And sometimes we just have to, it really comes down to, Rochelle, stopping the stigma and asking the questions. And if you think about it, if you're concerned about somebody, reach out to them. Reach out and call them. Say, hey, how you doing? You were on my mind today. That's a good opening. You were on my mind. I was thinking about you all day, and I wanted to just call you. Because sometimes we just ignore that little voice in our heads, and that's God talking to us, right? And we got to listen to that sometimes, all the time.
Yes. I want to go over real quickly some facts and some myths as they relate to mental health. And one of them is Christians depressed.
Yeah, we know that's a myth, right? Because we know depression affects everyone, single person, and on some level that we all have moments where we feel down and sad, and it has nothing to do with your religion, lack thereof. Either way, right? It can happen to anyone, and even as Christians, we have to be more aware and open to talking about it, and knowing that everyone has struggles at different times of their lives. Everyone does. Everyone can feel down, depressed, right? And we can use our faith to help us through that. But yeah.
Number 2 says, if you take medication for mental illness, you're weak.
Oh boy, this one for sure, right? It's a myth, right? And that's part of the stigma, is that people think that if they take medication, they can just will themselves out of it, right? There's something wrong with me. Why am I not strong enough to just feel better, right? And we know that part of what happens when we start to feel depressed, you can get sort of out of balance with those chemicals, those brain chemicals, your hormones, right? Because we even know that if you have a low thyroid, that can make you feel depressed, right? So the important thing is talk to your provider, because maybe there's some blood tests we need to do to see why you feel down. Maybe you are hypothyroid, or maybe you're anemic and that's why you're tired all the time, right? And so we need to talk about it, and we need to know that there are certainly medications that can help people feel better. And taking that medication doesn't make you weak, because your faith and the medications go hand in hand to make you feel better.
Absolutely. The next one is therapy is for crazy people.
Then we must all be crazy. Okay. Listen, I tell patients all the time, I tell friends, anybody I can talk to. So everyone could use someone to talk to. Therapy is simply getting a sort of third party, non biased help opinion about something, right? It might be for someone, childhood trauma, right? And you're an adult now and you've tried to sort of, I'm okay with whatever happened to me in my childhood, but it's actually affecting your current adult relationships. And talking to someone helps to give us a different perspective on things that we've gone through, give us tools. And that's why people go to school, just like I go to school to be a doctor. They go to school to learn how to support people through different situations. And um, life is about these experiences that we go through and how we sort of react to them. And we can learn different tools, because we react to things how we learn to react to things, right? And if you want to change that trajectory of how we react to things, we have to learn different tools to do that. And that's where talking to a therapist can come in.
Yes. I want to jump into breaking the silence. What do you think are some signs that a person may be struggling mentally, even if they say, I'm fine?
Yeah. If you know them pretty well, you can go deeper with that. So as I said before, like if they are not doing things that they normally would do with you, that that you've seen, that they're not doing, right? You can mention that to them. And when you do, you want to also say something to the effect of, yeah, I'm concerned because we always used to go out on, this time to do so and so. And I'm just concerned that you may not be feeling like your normal self. And know that you can talk to me if you feel, if you're feeling a certain way, or go talk to your provider or so. So giving them that and making it normal to be feeling, down or depressed, right? I always say that in order for someone to feel like they can talk to me about it, they have to feel like it's okay. They're not going to be stigmatized or say they're crazy, or you can just, will your way out of it. So part of it is recognizing those things for ourselves. It's sort of also recognizing, how am I sleeping? How am I functioning at work? Is this affecting my relationships with friends, spouses, children? Um, and really, there's two parts to breaking the silence. It's recognizing that there's an issue, and then being proactive about moving and doing something about it. And that comes from the lay folks, and it also comes from the professionals, your doctors, that you're seeing, recognizing that there's an issue.
What would you say are some first steps that a person could take that feels mentally overwhelmed, but they don't know how to ask for help?
Oh boy, yes. So there's a few things. Without being able, if you're not able to ask for help, you can find that one person that may be a support to you. We talked about, prayer and faith. Going to, your faith community. It's hard for someone to ask for help. But if they go, and one of the things we always talk about is going for your annual checkup, right? Because there's a lot of things that we can assess and sort of pull out with the certain questions that we ask on that annual, right? So even going to your doctor for that checkup and having us do those questions. But the thing is, if your doctor isn't asking those questions, that's how these things get missed, Rochelle. That's how people are like, well, if my doctor didn't ask and didn't do anything, then it must not be that important. And then they suffer in silence and they keep suffering in silence. Well, my doctor didn't do anything about it when I told them I felt anxious or that I was having heartburn, because maybe that person thought if they said heartburn, that would lead to some more questions because they can't say the words. And it really comes from our community and the provider community being more aware, and then also, making it normal and talking about it and letting people know that, we all have struggles at different times in our lives, but talking to someone can give us a different perspective on it. And when I talk to patients about therapy, um, especially if some patients have gone to therapy before and they're like, it didn't work for me, I will use an analogy. I'll say, well, if you tried on one dress and you didn't like how that dress looked on you, would you stop wearing dresses altogether? Or would you find the dress that fits you right, that makes you look good? You know, and so I think of it the same way. You have to find a therapist that works for you. So people might be listening and be like, oh, I tried therapy before, it didn't work for me. Um, Try a different therapist, try someone else.
I like the analogy. It makes
Yeah.
so much sense. I know that you touched on social media as it relates to teens and children and how it can affect their mental health. How can parents talk to their children about mental health without scaring them, without shaming them, in hopes that they will share with them?
Yeah. Two ways. One is if a parent is comfortable enough in sharing their own experience, they can use that, right? Because for kids, sometimes if we don't, depend on the age of the child, we don't think it'll scare them, right? We can use our experience to say, hey, maybe when I was your age, I kind of felt really stress trying to fit in at school, right? I joke with my kids all the time. I was a nerd when I was in high school. I didn't fit in. I didn't have many friends, right? But I did have one or two friends that were a good support for me, right? And so talk to them about your own experiences growing up and how, and not sugarcoat it, but really what was your struggle back then and how you worked through it. And then, so if you're comfortable, you can do that a little bit with depending on the age, if they're teens, especially for sure. I think sometimes that helps them to know that you're not just this mom parent, but you were there at one point. Um, and then also, you can bridge conversations by just asking in general too about your concern, right? I know when my daughter, she's 23 now, but when she was younger, we would have conversations about the things that you see on social media um, are not always true, right? People put different masks on, especially on social media, and we're not getting the true picture of what a person's life and experiences are. And I said, think about your experience. Some days you feel great, some days you look good, some days you don't feel so good. That's a normal experience. But we tend to put all the great things out on social media. So you're only seeing one aspect of a person, but we know that people are multidimensional. Some days are good, some days are bad. Some days you look good, some days you don't. It's the same thing.
Angela said also mental health is very much hereditary and ignored, especially in the Black community.
Yeah, I mean that is true. There is some, I would say, hereditary or genetic, maybe predisposition. So we will ask people as part of that family history, right? Is there mental health? Anyone in your family with depression, anxiety, or especially those serious mental illnesses like bipolar, schizophrenia? The studies aren't great on it, but we think there is some sort of genetic predisposition to those depending on if you've had that in your family. And then the genetic component, I always say, is not doesn't mean you are going to get it, right? It means that there's so many other multifactorial things that play into, who expresses that serious mental illness and who doesn't. But there is some hereditary component to it, and we ask that too as part of our wellness exam about family history. It shouldn't just be about who has diabetes and heart disease. It's also who has serious mental illness in the family. Thank you for bringing that up. Yeah.
I wanted to highlight, well, she said something else. Hold on. She said, you are definitely right about the social media statement.
Oh boy, yes. Life before social media. I think it was so much simpler, but we can't turn it back now. It's like the genie out of the bottle. So.
Absolutely. I wanted to highlight some of the individuals that are celebrities that are doing something about mental health. And I know that Taraji Henson has her foundation that was founded with her dad or for her dad, Boris Lawrence Henson, in honor of her late father to increase access to mental health services in the Black community. And then you have Dwayne "The Rock" Johnson. He spoke openly or has spoke openly about battling depression. And then Selena Gomez, she's open about being diagnosed with bipolar. She created Wonder Minds to promote mental fitness. We all heard of Michelle Williams of Destiny Child. She's spoke openly about being depressed, and she's a Christian performer. And then Simone Biles, Olympic gold medalist, away from the competition because of her mental health. It sparked global conversations about mental health.
And all of them talk about openly their journey and talking to their therapist, right? About what are the tools I can use when I start to feel down, right? Because that's part of life. Is it meditation, prayer, exercise? What do I use to bring myself back to center when I start to feel, in a certain way? And highlighting these people who were like, well, what do they have to feel depressed about, right? Because we kind of think, well, if I have depression, I must be this way and not that way. But it's anyone, anytime can have that. That can happen too. And removing that stigma happens when people, like Simone, I don't think he mentioned Kevin Love, the basketball player, talk about it and normalize it and say that, hey, it's okay, but let's talk about it. Don't suffer in silence. Very key.
Don't suffer in silence. So tonight we learned that healing requires honesty, help, and hope. And mental health is not a weakness, it's a part of our overall wellness. And God meets us in the valleys as well as in our victories. So, Dr. Michelle, before we close out, what are some final words of wisdom that you can offer to someone who may be silently struggling right now?
Yes. Well, I love what you just said about all of that. But I say, our brain is an organ just like any other organ, and we have to take care of it just like we do our kidneys and our heart. And when we're not feeling good, when we're feeling mentally stressed, that it's important to speak up, speak out, and take action, that we don't have to suffer in silence, that we know that depression, anxiety can affect any of us at any time. And I want everyone out there that's listening to know that they have support in the medical community and in the mental community, and that I want you to reach out to the resources in your community, to your provider to help connect you to that, to your insurance plan if that's something that you want to do, to talk to a therapist to help you through those difficult times. It's just really about getting the tools to navigate this thing we call life.
Awesome. Can you tell them how to stay connected to you?
Yes, they can find me on Facebook at Doc Michelle. I am available for any talks on any health and wellness topics, and I'm also on your show once a month.
Yes, thank you so much, Dr. Michelle. I always appreciate you educating us so that we can take action with our health, physically and mentally.
Yes.
You guys, please do not go anywhere. If tonight's topic has touched you and it has made you think about your mental health, then I encourage you to drop a comment, to share this broadcast with someone who may need it so that they can know that they are not alone. And I'll post in the comments some trusted mental health hotlines and resources that you can use in your own time. I encourage you to stay connected, stay aware, and to stay in action. And make sure you join me next Monday at 6 p.m. right here on Intellectual Radio. As always, thank you for tuning in to Warriors Talk with author and founder Lady Rochelle, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady Rochelle. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady Rochelle on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady Rochelle, where we encourage, educate, and empower you into action.